This framework looks at 5 points of engagement with the frontline health workers. The first is on learning and education to see how we can improve skills and capability. The second is on rewards and recognition to ensure that our nurses and midwives are properly recognized for the work that they do. The third is on leadership and management, to build their own leadership and management skills. The fourth is on linkage and connection, where we try and ensure that our nurses and our midwives, wherever they're working, feel connected into the system and therefore are able to get the support they require when they need it. And the final one is on resilience and well-being, where we want them to be able to practice self-care so that they're able to consistently deliver on the healthcare services that we need in the healthcare system.
Nurses, once empowered, once they are standing within the community, once we create social value for the nursing and midwifery profession, it means that now nurses and midwives have better place to innovate. And that innovation helps us deal with demands for healthcare within an environment where there is resource constraints, but there's a lot of opportunities to actually think through how we can solve various problems innovatively.
Our role in this alliance is to come up with a centralized nursing platform, a digital platform that will help in communication and data exchange for the nurses and midwives, improve the availability of nurses, just know where the skills are required and how we can avail them.
Recruit members who are interested in the caring profession for maternal and newborn. Make sure they are trained, and also we do research together so that we can improve the quality in a continuous manner.
We are providing strategic input in terms of strengthening the capacity of pre-service training institutions, where we are supporting the midwife training institution in terms of curriculum and syllabus development.
All the nurses are going to be taught in civic education. We shall do that gracefully and everywhere so that the nurses understand what is expected of them. We also expect to develop a policy that will direct them in their delivery of services.
Scheme of service is a document that now will define a clear career pathway for each and every nurse and midwife. It will be very clear, and that helps us in negotiation for the welfare and probably better emoluments for the nurses and midwives of Kenya.
Every frontline nurse and midwives working for the community, working for the public to operate within the scope. So efficiency, effectiveness of the services, and again the reduction of the mortalities, the morbidities rates is really our triple effect for this Service Alliance.
When nurses succeed, the population has succeeded. So having this alliance is going to be a blessing to the Kenyan population, because we will have, one, a nurse who is competent, two, a profession which is united, and three, a profession that has motivated nurses, and therefore healthcare will go a notch higher. Kenyans will be able to benefit.